There's other DNA testing that can be done for other chronic diseases and such. I mean, you may be biased in this case, but would you see that there's maybe, if someone were to focus on, the DNA testing for chronic diseases and such versus the DNA testing that your company provides, what would you suggest to people? And what would you say is the validity and reliability of those DNA testing kits?
So the tests for disease, those are only reliable for what's called high penetrance genes. So these are genes that are basically that cause disease. So I don't know if you're familiar with BRCA1 and BRCA2, BRCA.
Yeah.
These are
Yeah.
breast cancer
Yeah.
causing genes. So if you have that genetic mutation, then you have a 95 to 100% chance of getting breast cancer.
Wow.
And women who test positive oftentimes elect to have a bilateral prophylactic mastectomy, removal of both healthy breasts, because they know that they will probably develop breast cancer. And usually there's a family history of that, of early onset breast cancer. But what's interesting is about 90% of cases of breast cancer have nothing to do with those particular genes. They're due to a combination of multiple genetic markers and multiple environmental factors. So unless it's an early onset form of a disease, a genetic test for disease risk prediction is useless. And so this is where the modifier genes or the nutritional metabolic genes are important, because it tells you how your body, it doesn't tell you your risk of a heart attack, but it tells you if you consume a large amount of coffee or more than 4 cups, then that'll increase your risk of a heart attack, or salt sensitive hypertension, not just hypertension in general. And so there are, a lot of people are familiar with 23andMe. Which really, I think, has done a great job in terms of kind of democratizing genetic information and popularizing it. But again, one needs to be cautious because, they provide information on celiac disease, but they only test 2 genetic markers, whereas, we test 6 that provides a more comprehensive assessment. And I know someone personally who 23andMe told them, you do not have the gene for celiac disease. And that made them kind of rule out the possibility. And then they got our test and it said, you have the highest risk. And they ended up getting antibody tested and eventually biopsy confirmed celiac disease, where 23andMe told them, you do not have the gene for that.
Interesting.
So for any of your listeners, if you were ever concerned about celiac disease and you did a 23andMe test and they told you you don't have that gene, you need to kind of reevaluate that, speak to your physician about getting antibody tested. So again, there are some companies that obviously provide good information, but others where it's absolutely dangerous and misleading that can cause even greater harm.